Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about panic and why magnesium deserves a careful, medically honest discussion. If you have ever had a panic attack, you know it can feel like your body is declaring an emergency. Your heart races, your chest tightens, your breathing changes, your hands may tingle. You may feel dizzy, shaky, hot, cold, detached, or convinced that something terrible is about to happen. In the emergency department, I see this often. People arrive frightened because the symptoms feel physical, intense, and dangerous. And here is the first important point. Do not automatically assume it is just panic, especially if it is your first episode. If you have chest pain, fainting, one-sided weakness, new confusion, severe shortness of breath, a new irregular heartbeat, or symptoms that feel different from anything you have had before, get evaluated. Panic can mimic heart, lung, thyroid, neurological, medication-related, and substance-related conditions. Look at the whole picture. Ask yourself, is this new? Is this severe? Is this associated with exertion? Is there fainting? Is there pregnancy? Is there known heart disease? If yes, do not sit at home trying supplements. Seek medical care. Now, once dangerous causes have been considered, we can ask a more practical question. Why would magnesium help some people who struggle with panic sensations? Magnesium is not a sedative in the way many people imagine. It does not switch off fear like a light. It is a mineral involved in hundreds of enzyme systems in the body. It helps regulate nerve signaling, muscle contraction, blood pressure, glucose control, and energy production. So when someone asks, can magnesium help panic? The better question is, could low or suboptimal magnesium make the nervous system more reactive, and could correcting that support better regulation? That is a more medically grounded way to think. Look at what panic does inside the body. Panic is not weakness, it is a threat response. The brain detects danger, even when the danger may not be external. The sympathetic nervous system activates. Adrenaline rises. Breathing becomes faster. Carbon dioxide may drop, especially with hyperventilation. That drop can cause tingling, dizziness, chest tightness, and a feeling of unreality. The heart beats faster because the body is preparing to escape. Muscles tense, the gut may churn. The mind then notices these sensations and says, something is wrong. That fear amplifies the body response. The loop feeds itself. So where does magnesium fit into this loop? Start with nerve excitability. Magnesium helps regulate the movement of calcium and other charged particles across nerve and muscle cells. Why does that matter? Because nerves communicate through electrical and chemical signals. If that system is more easily triggered, the body may feel more jumpy, tense, or reactive. Magnesium also interacts with NMDA receptors, which are involved in glutamate signaling. Glutamate is one of the brain's main excitatory messengers. Too much excitatory drive or poor balancing of that drive may contribute to anxious arousal in some people. Magnesium is one of the body's natural brakes in that system. Now look at the calming side of the nervous system. The brain does not run on signals alone. It also uses inhibitory signaling, including GABA pathways, to create restraint, calm, and control. Magnesium may support this balance indirectly. That does not mean magnesium is a replacement for therapy or prescribed medication. It means magnesium may help create a more stable background environment for the nervous system, especially in people who are deficient, stressed, sleeping poorly, or losing magnesium through diet, illness, alcohol use, certain medications, or chronic digestive issues. Pay attention to the body symptoms of panic: tight chest, tight neck, trembling, muscle cramps, restless legs, jaw clenching. Magnesium is deeply involved in normal muscle relaxation after contraction. If magnesium intake is low, muscle tension can become more noticeable, and when a person already fears bodily sensations, muscle tightness can become a trigger. They feel tightness, then fear the tightness, then breathe faster, then feel more symptoms. Do you see the cycle? Magnesium may help some people by reducing the physical background noise that panic can grab onto. Sleep is another key pathway. Ask yourself, when are panic episodes worse? Often during periods of poor sleep, shift work, grief, overtraining, alcohol use, high caffeine intake, or ongoing stress. Magnesium is not a sleeping pill, but some studies suggest it may support sleep quality in certain groups. Better sleep can reduce the brain's threat sensitivity. Why? Because a sleep-deprived brain is more reactive. The amygdala, which helps process fear, can become more responsive. The prefrontal cortex, which helps evaluate and calm fear, may be less steady. So if magnesium helps a person sleep a little better, that may indirectly reduce panic vulnerability. But let's be honest about the evidence. Research on magnesium for anxiety shows possible benefit, but the quality of studies varies. Some studies combine magnesium with other nutrients, such as vitamin B6, so it is hard to know what magnesium alone is doing. Some include people with general stress or premenstrual symptoms rather than diagnosed panic disorder. There is not strong proof that magnesium by itself treats panic disorder. Do not hear me saying that. Hear this instead. Magnesium may be a supportive tool, especially when intake is low or symptoms overlap with tension, poor sleep, and high physiological arousal. This distinction matters. Panic disorder is usually treated with evidence-based approaches such as cognitive behavioral therapy, exposure-based strategies, breathing retraining when appropriate, and sometimes medications such as SSRIs or other clinician-guided treatments. Magnesium can sit beside that plan, not replace it. If someone is having repeated panic attacks, avoiding normal activities, fearing the next attack, or using alcohol or sedatives to cope, they need a real evaluation and a structured plan. Now, how should someone think about using magnesium safely? Start with food. Do this before jumping to pills. Look at your plate. Magnesium-rich foods include pumpkin seeds, chia seeds, almonds, cashews, peanuts, spinach, black beans, edamame, whole grains, dark chocolate, and some fortified foods. Food gives magnesium along with fiber, potassium, and other nutrients that support metabolic and cardiovascular health. If you can improve magnesium intake through food, that is often the safest foundation. Then look at factors that lower magnesium. Ask yourself, do I drink alcohol often? Do I use high amounts of caffeine? Do I take a proton pump inhibitor for reflux for a long time? Do I take certain diuretics? Do I have chronic diarrhea, inflammatory bowel disease, uncontrolled diabetes, or kidney disease? These details matter. A person may be anxious not because of a single mineral issue, but because the body is under repeated stress from many directions. If considering a supplement, discuss it with a clinician or pharmacist, especially if you take regular medications. Magnesium can interfere with absorption of some antibiotics, thyroid medication, and osteoporosis medications if taken too close together. Spacing matters. Do not take magnesium casually if you have kidney disease, because the kidneys clear extra magnesium. Too much can cause low blood pressure, weakness, confusion, slow heart rhythm, and in extreme cases, dangerous toxicity. More is not better. Also pay attention to the form. Magnesium oxide is common, but may be more likely to cause diarrhea and may not be absorbed as well for some people. Magnesium glycinate is often chosen because it tends to be gentler for the stomach. Magnesium citrate is absorbed reasonably well but can loosen stools. Magnesium chloride and lactate are other forms. The best form depends on the person, their bowel habits, medication list, kidney function, budget, and goals. Dose matters. Many adults already get some magnesium from food. Supplements usually should stay within safe supplemental limits unless a clinician is treating a diagnosed deficiency. A typical over-the-counter dose might be modest, often taken in the evening, but do not stack multiple products without realizing it. Check your multivitamin, sleep blend, electrolyte powder, laxative, and antacid. You may be taking more magnesium than you think. Pregnancy deserves special caution. If you are pregnant and having panic symptoms, do not self-treat without professional guidance. Pregnancy changes heart rate, breathing, blood volume, reflux, anemia risk, clot risk, thyroid function, and medication safety. Magnesium has medical uses in pregnancy under supervision, but that is not the same as self-directed supplementation for panic. Now let's connect magnesium to a practical panic plan. When panic begins, do not fight the sensation with frantic checking. Look at the pattern, name it. My threat system is activated. Then slow the loop. Put one hand on the abdomen. Breathe gently through the nose if you can. Make the exhale longer than the inhale. Do not overbreathe. Do not force huge breaths. Panic often worsens when people take big repeated breaths and drop carbon dioxide further. Try breathing in softly for about 4 seconds, then out for about 6 seconds. Repeat. Let the shoulders drop, then ground the body. Press your feet into the floor. Look at 5 objects in the room. Describe them. Feel the chair under you. Tell the brain, through action, I am here and I can stay. Why does this help? Because panic pulls attention inward toward the heartbeat, chest, throat, and thoughts of danger. Grounding moves attention outward and gives the brain safer data. After the episode, do not just celebrate that it ended and ignore the pattern. Review it like a clinician. Ask yourself, what happened in the 24 hours before? Poor sleep? Skipped meals? Too much caffeine? Alcohol withdrawal? Conflict? Illness? A new medication? Too much screen stimulation at night? Hormonal timing? Dehydration? Magnesium intake is one piece, but panic is often a system-level issue. If you choose magnesium, track it. Do this for 2 to 4 weeks. Write down panic frequency, sleep quality, caffeine intake, alcohol intake, bowel changes, and any side effects. If diarrhea starts, the dose or form may be wrong. If you feel weak, lightheaded, or your heartbeat feels abnormal, stop and seek advice. If there is no benefit, do not keep increasing the dose. More magnesium will not fix panic that needs therapy, medication adjustment, trauma care, thyroid testing, anemia evaluation, or cardiac evaluation. Also be careful with online claims. Magnesium deficiency can cause neuromuscular and cardiac symptoms, but not every anxious person is magnesium deficient. Blood magnesium testing can be imperfect because much magnesium is inside cells and bone, but testing may still be useful when deficiency is suspected, especially with risk factors. Let your clinician decide what testing fits your situation. Here is the balanced message. Magnesium may be beneficial for panic-prone people by supporting nerve stability, muscle relaxation, stress regulation, and sleep. It may be most helpful when the person has low intake, high stress, poor sleep, muscle tension, or factors that deplete magnesium. It is not a cure, not an emergency treatment, and not a replacement for panic disorder care. So start with safety. Rule out dangerous causes when symptoms are new or severe. Build the basics: sleep, food, hydration, movement, reduced caffeine, reduced alcohol, and breathing skills. Add magnesium thoughtfully if it fits your health profile. Ask your clinician or pharmacist if you take medications, have kidney disease, are pregnant, or have chronic medical conditions. Panic feels powerful, but it is not always in control. When you understand the body loop, you gain options. When you support the nervous system from several angles, you give yourself a better foundation. Take care of your body, take your symptoms seriously, and do not be ashamed to ask for help. I'll see you in the next topic.